A new report from the Institute for Oral Health finds the visits are not for sports injuries, but for issues like cavities and infections. Right now, we are joined by pediatric dentist and CEO of SuperMouth, Dr. Kami Haas. Thank you for joining us this morning.
Thanks for having me.
Well, can you tell us what's really behind the sustained increase in pediatric dental emergencies?
Okay, well, let me start by saying something that may shock you. The #1 disease on the planet is actually not cancer or heart disease, it's dental disease. In kids, it's cavities, and in adults, it's gum disease. And the last few years, this has gotten a lot worse. Since COVID started, people avoided going to the dentist, but cavities don't stop, right? They get bigger, gum disease advances more. That's one issue. The other issue is we don't have enough dentists, especially pediatric dentists, to take care of these kids and turn a problem that could be saved by $80 filling, turn into $5,000 treatment at emergency rooms. And then our federal government and the states are not helping with budget cuts. Like in California, they're cutting Prop 56. That's going to significantly impact Medicaid coverage for kids and puts millions of more kids into the emergency rooms, unfortunately.
Right. That means it's less likely that they will go every 6 months as normally instructed. Now, why aren't ERs the best place to treat these dental issues?
Yeah, it's hard enough for a pediatric dental practice that's experienced, that has gone through years of dental school and pediatric specialty to treat kids. Kids are young. We want to make sure they have a great experience. We want to focus on prevention. Emergency rooms are completely not for that reason. They're there to take care of emergencies. And as I said, they're not only not equipped, they don't have the experience, they don't have the dental equipment that's necessary to do it, but the cost of treatment goes from, it could be quadrupled or 10 times the cost, and the public is going to eventually pay for it. So we really need to remind everybody, including our politicians, that cavities don't stop, they get worse. Prevention is really the key to everything.
Exactly. Now, what are some of the signs if your child is having a dental issue that is bigger than a cavity?
That's a great question. So I think a lot of kids that have a lot of pain for a long time, they just kind of ignore it. They don't even complain about it, but they could impact their sleep. So they could impact their behavior during the day, their school attendance, what the kind of grades they get. They have a swelling, especially for the parents, if they see swelling inside the mouth or especially on the outside, that could be very dangerous because an infection in the mouth can actually very quickly transfer to the other part of the body, including the brain. And so it impacts nutrition. All of these things are really critical for a child's development, mentally, physically. So it's really important that we take care of oral health as seriously as we do every other part of the medical care.
All good to know. And as we know, it's important to brush your teeth as well as flossing. But can you remind us of some of the simple habits that kids need to know to keep their teeth healthy?
Yeah, that's actually a really, really great question, because our model of just brushing and flossing, unfortunately, hasn't been working because it's still the #1 disease on the planet. So there should be other things. For example, our obsession with fluoride. If you're for it or if you're against it for 30 years, that's bad because your mouth is not just enamel to be zapped with just one ingredient. We've known about the benefits and risk of it for a long time. And if you want to use it and if you have a high risk, great. And if you don't, at least don't use non-fluoride, for example. Non-fluoride is a meaningless term like non-chicken or non-broccoli. You want to get nanohydroxyapatite in your toothpaste and mouthwash and floss. Vitamin D and vitamin K2. You want to use prebiotics that promote a healthy oral microbes instead of wiping it out. You want to use alkaline products. So there's a lot of things that we want to really educate the public. And that's another reason why people should go to a pediatric dentist, because they have that education so they can educate the parents and the kids versus the ER, which really they're not trained for that purpose.
And kids will hate to hear this, but stop eating the candy. The gummy candies and sugar and stuff like that does not help.
No, it's not just, it's for sure, sugar is one problem, but of course, acidic foods. But it's not just what's in the food that's bad. You want to make sure that what you're avoiding is also important, right? So you want to make sure you're taking enough vitamin D, vitamin K2, calcium, make sure you drink enough water, and make sure you really take care of your mouth like it's another organ in your body. It's not just a surface that you want to disinfect it and scrub it with teeth. It's an organ, just like you treat the gut microbes, you want to treat the mouth, and you want to take care of it as the opening to the body.
Dr. Kami Haas, I could talk about this all day. Thank you so much for joining us this morning.